And Dr. Michael Warner now. He's an ICU physician at Michael Garron Hospital. Dr. Warner, great to have you back on the program.
Hi, Angie. Nice to see you.
I want to get your reaction here as we're looking at numbers. And I want to refer to a tweet that you put out on Friday that really just sort of speaks to all of this. You tweeting out that on Friday, saying the same day that you're being asked to help with overwhelmed ICUs in the GTA, the Ontario government announcing red zone restaurants can increase indoor dining up to 50 people. You saying there, we are pushing and pulling at the same time. Your take as Ontario logs today well over 1,800 cases.
So first things first, I mean, the Chief Medical Officer of Health for Ontario says that we're in a wave 3 and that he doesn't know how bad it's going to be. So if we don't know how bad it's going to be, why would we do things that increase the likelihood that it's going to be worse than it could be? And indoor dining in the red zone regions, increasing capacity from 10 to up to 50 is a mistake. When you take your mask off to eat, when you're amongst strangers, that's an environment where COVID-19 can spread. When you have people working in restaurants who sometimes are younger people, who almost certainly won't be vaccinated at this point, having more people in those restaurants increases their exposure risk. When you do things that make it harder for public health to do their job by increasing their contact tracing load, if we get an outbreak in a restaurant, taking them away from the vaccination effort they should be focused on, that's not a good idea either. So this whole thing doesn't make sense. The outdoor dining in gray zones, I think, does make sense because ventilation is 100% outside.
Right, exactly. And of course, with that, we're also dealing with the variants. We're also noticing that a lot of the cases are involving younger adults.
I think at this point it's anecdotal whether younger people are getting sicker with the new variants. I mean, as we vaccinate from the age 100 downwards, the average age of patients in ICU should go down because older people will likely be protected. But Angie, we have to remember that during waves 1 and wave 2, long-term care home residents almost never landed in the ICU. In fact, 90% of patients in ICUs right now with COVID-19 are under the age of 80. And 74% of all the patients who've died in wave 2 from COVID-19 are under the age of 80. So the vaccination effort in Ontario, which is based on age at this point, will not really change things in the near term for ICU capacity in the province.
As you're talking about ICUs there, what are your numbers looking like? We're well into the 300 range, is my understanding. You, of course, again, as you noted, that your hospital is being asked to sort of help with ICU capacity. So your take on here, looking at where we stand on ICUs and where the government or the province is standing on their decisions around restrictions with COVID-19.
So Toronto and Peel are encircled by the red zone, where indoor dining will be allowed up to 50 people. Toronto and Peel are the hardest hit regions. The province isn't uniformly affected. Ottawa, even though it just moved from orange to red, which interestingly doesn't change the number of people allowed in their restaurants, is doing much better than Toronto, but it's a completely different city. We have 355 patients in Ontario's ICUs right now with COVID-19. We crossed the 300 threshold on Christmas, so for the past 85 days, we've been over 300. Our nadir was 310. Our wave 2 peak was 420, which I think we will exceed. We have capacity, but it comes at a cost, and that cost is delaying and deferring non-COVID related care. There are over 200,000 delayed and deferred surgeries so far, and that number increases by the day.
Dr. Warner, I'm almost out of time here, but what do we need to do? What's your advice to the province here?
We just need to wait a little bit. Give us 1-2 months. Let's vaccinate more people. Then we can open things up in a safe and sustainable way. What we're doing right now does not make any sense and will make it much less likely that we're going to have the summer we all deserve.
The numbers you talk about in the ICU certainly raising a lot of concerns, let alone, again, the caseload we're seeing in the province. Dr. Michael Warner, ICU physician at Michael Garron Hospital. Dr. Warner, always great to have you. I know you're working today. Stay safe. We'll talk to you again soon.
Thank you.
You're welcome.